Welcome to the Retrospect podcast, a show where people come together from different walks of life and discuss a topic from their generation's perspective. My name is Ian, and as always, I'm joined by Jason.
Hello, everyone.
And normally it would be Stoney, but he's playing hooky today.
Mrs. Stoney is in the house.
And I
am filling in for Stoney today.
We'll give him a pass.
Yes, he had a rough day. He had a really rough day. Today was the first full day of PT and speech therapy, and he was just absolutely fried by the time he was done with that. He had nothing left in him to get here. So I am filling in for him. So hold on.
Hey, hold on. I don't like that. That feels like a threat. I'm playing.
Hey, you never know.
You're right. Miranda, you look like you got more notes than I have. So
I have you know that today's topic is something that's near and dear to my heart. So I came with receipts.
There you go.
There you go.
And well, speaking of that, we have a lovely guest, Lauren. Go ahead and tell the people what all of you specialize in.
So I'm a women's health and orthopedic physical therapist, and I specialize in spinal dysfunction and pelvic floor dysfunction. That's my little niche, however you want to say it, tomato. So yeah, and I'm the owner of Integrative Spine and Pelvic Health.
Wonderful. And so it feels a true return to form this week because, like we said before, Jason's got some papers here. So I'm excited to see what are some. It feels good. It feels good.
I had to try to do some research on this because I don't know anything about this kind of stuff. So it was like,
right.
you got to throw me a bone here.
My fiance works in the natural birth world. And so she knows, is in the same sort of sphere.
We're in the same world.
Right. And so
yes.
I feel like I know a lot of this secondhand because, again,
cool.
She talks about it a lot and is also very passionate about it. And so I feel like because of that, I'm also pretty passionate about some of the things that she's a part of.
Exactly
right. Yeah, you're like, oh please, let's talk. Exactly right. So,
okay.
So what is this? What are we gonna start today with?
Well, I'm gonna ask here. Okay, I doing pulling some of this research. What is a pelvic floor?
Okay.
Tell me about that.
So your pelvic floor.
I was going to be sarcastic, but I didn't.
I know. No, actually, this is a really good question.
You're right.
Because we throw around this like, pelvic floor, but a lot of my patients are like, but what is this? What's going on with me? What is a pelvic floor? So your pelvic floor consists of your pelvic joints, muscles, and nerves. And so it's a sling of muscles that go from your pubic bone to your tailbone. And they are responsible for bowel, bladder, and sexual function. So I'm a bowel and bladder specialist, and I also call myself a sexual education counselor.
Wow.
So
I didn't know it was encompassed all of that.
Right. So really, if you think about anything in your pelvis, so like your hips, your bladder, your bowel, your reproductive organs, the nerves in your pelvis. That's our jam.
Right.
And the muscles and the organs work together. So if there's something going on in your bladder, in your bowel, your uterus, then there's also something going on with your muscles.
Interesting.
So.
And I just wanted to pipe up here that, we're looking at this from a women's perspective today.
Right.
But 16% of men end up with pelvic floor dysfunction, too.
I was about to say, I've heard this.
I was reading some of this. I was like, I wonder if I have some of this. I don't know. Because they were talking about active, like people who engage in a lot of strenuous activity. Well, my whole life, I was a weightlifter and lifted way too much weight.
Well, and put anything where you're doing that Valsalva, where you're kind of pushing down or bearing down on things.
I did a lot
stresses out that area.
Squats and deadlifts, and unfortunately, I'm paying for it now. But
and I want to kind of, side eye on the 16%, because it's probably more than that. It's because,
right.
So for men, how does pelvic floor dysfunction present? Well, it can be, can I say premature ejaculation? Okay. Sorry, I didn't know what I could say. I talk about this like the weather.
You're right.
As a sexual health counselor. But it could be premature ejaculation, erectile dysfunction, pelvic pain,
constipation.
Constipation, exactly. And men tend to not seek help for these issues, so therefore the
data is lacking.
The data is lacking, exactly. And so too with women, 1 in 3 women, statistically have pelvic floor dysfunction, but really I really want to say it's probably like 50%.
Well, 50% of women over 50 have it.
Yes.
So we know the odds are in your favor that you're going to have it at some point.
And I'd say a lot of young women, I would still say like 50%, honestly.
Wow.
It really is.
Well, according to this study, I read that it said that the frequency of pelvic floor disorders increases with age.
Correct.
Affecting more than 40% of women from 60 to 79 years of age, with about 50% of women 80 and older. Yes. So it appears to be something that's almost inevitable.
Yeah.
Well, part of it is because of hormones, right? So as women enter perimenopause and menopause, we lose estrogen. And what is estrogen responsible for? Well, estrogen builds up your muscle, your bone, right? So, we tend to think about it as just like,
it
this
maintains
reproductive
elasticity. Yes.
Elasticity,
yes.
Exactly. Like we tend to just think of estrogen, in our reproductive ages, as like a sex hormone that, but, that's why women have more osteoporosis than men.
Oh, wow.
Right? More heart disease. It's because estrogen starts to decline. And so as estrogen declines, well, all muscle function.
Wow.
Right? So that's part of it. Also, what we're seeing is these obstetric injuries that are occurring to women when we're young, like in our 30s. There's some women are having babies in their 40s, which is awesome and great. But, in our 30s, they're coming back to haunt us. They're coming back to haunt us in perimenopause and menopause. So my passion in life that fuels me and gives me so much joy is helping women that are pregnant, and I'm trying to prevent these injuries from happening.
Oh, okay, I see.
So, right? It's preventative.
That was going to be my question is there something that people could do to like actively watch out for stuff like that? I know I'm probably jumping ahead of myself, but that's
there is. And it's, so I have a birth prep program, and I help women prepare for birth. And it naturally, or if they decide to get medication, but it's basically to reduce their risk of an injury during birth so that they can recover really well and then help them, reduce their risk of having a bad pelvic floor dysfunction as they get older. Sorry. I'm like starting to get
it's okay. You're good. Lean back. You can push as far as you want.
So there is a lot of preventative measures.
Interesting.
Yeah.
What kind of drove you to this?
Yeah.
I'm curious.
I get this question
what's the
every
motivation?
single day.
I mean, there had to be something that kind of
So, before I got into pelvic health, I was, like I mentioned, an orthopedic physical therapist, and I was treating shoulders and knees and toes and elbows. And
now you are the Kegel master.
And now, I'm about to debunk that too. We're about to talk about Kegels. That's a whole nother.
I saw that up in the literature.
Yeah, talk about Kegels because I'm not. I'm kind of on an anti-Kegel campaign, and we'll talk about that.
A whole campaign
later. Yeah. But a lot of pelvic health physical therapists are on the anti-Kegel campaign, and I'll talk about that later. But anyway, so I was in orthopedics and helping people with their spine and their hips and their toes and their nose. But anyway,
Right.
I got pregnant and had a lot of pain. I had a lot of pelvic pain. I had a lot of issues during my pregnancy, and I was getting physical therapy. I was also getting chiropractic care because I was in tremendous pain. And I remember I had to advocate for myself during that time, because even my OBGYN, she's just like, I don't know, oh, this is normal. All of this is so normal. I'm like, I can barely walk. I can barely
This
function.
doesn't feel normal.
This doesn't feel normal, especially my mom, she was like, I mean, I was a pregnancy goddess. My mom on this podcast.
It was so effortless.
I can see that.
Jennifer
Yeah, I can
Richardson,
see that.
Right.
So,
Wait, I was going to say, can we say that for a second?
Absolutely.
So we had an episode a little while ago with Jennifer Richardson.
Right.
And with
What
her
episode was that?
I don't know what number it was. That's why I didn't say it. I'm keeping vagueness in my favor. But
I'm gonna look it up.
It was a few months back.
And she's your mom, is that correct?
yeah,
Okay.
she's my mom.
Wow.
And she started Keep Tiger Town Beautiful.
Right. Exactly. Yeah.
A bunch of litter
Yeah.
warriors.
Right.
I love her.
That are cleaning up
super
the
great.
city.
Exactly.
So, but yeah, she's awesome, and I have some big shoes to fill. But yeah, she's awesome. But she was just like, I felt great. Like, what's wrong with you? Anyway, to make a long story short, also had a very difficult birth. Wanted to have a natural birth. It didn't happen. Had a lot of issues postpartum. Luckily, I had a really good friend in pelvic health, and I was talking to her one day about some of the stuff I was having, some of the issues, and she's like, girl, you need to, she was in Florida. She's like, you need to find somebody in Baton Rouge to help you. You got some pelvic floor stuff. And I was like, oh, I did. You think that's why my back and my hip hurt and leaking? And I'm just going to I guess I'm just disclosing a bunch of stuff, but I think a lot of women can be like, oh, I can help a lot of women, but I was having pain with intercourse afterwards. And so I was like, okay, wait, so this isn't just going to go away?
Yikes.
And she's like, no, you need a little help. So anyway, make a long story short, got the help. And then I became so passionate about it. And every woman that I started to see, I was like, have you had pelvic floor physical therapy before?
You should really do that.
You should do pelvic floor.
Right.
Your hip and your back. I feel like I can help you a little bit, but you need to see a pelvic health. So I was sending all of my patients to see the pelvic health physical therapist, and then I just realized I want to do this.
Yeah.
I want to help women in this way.
That's awesome.
And then just kind of furthered my education in pelvic health over the last 8 years. I've been in pelvic health 8 years. Yeah.
That's awesome.
And so that's how it started.
Right.
And
I feel like a lot of specialists, I think I would wager, have a very similar story to that of being in one path.
Right.
And then finding that one thing, you're like, oh man, I really enjoyed this thing, or I really love helping out in this area. Because I've heard that story with some friends of mine as well. That's like, I did this for a while, and then after I realized I didn't really care for it, but then I found that one thing that I really love, and it went off into that, and they're now specialists in a certain field or whatever.
Well, one thing you have to keep in mind when it comes to women's health care is that women get the shitty end of the stick 9 times out of 10 in health care. Most medical studies are only done on men. And for over 50 years, only medical studies were done on men. Yes. So they don't even take into consideration differences in physiology or differences. It's like women tend to have more side effects from medication. They'll have 90% of the side effects from a reported medication are found in the female population.
Wow.
But they make up less than a third of any study. Right.
So, women are not little men.
No. But that is the way that healthcare sees them. And that's part of what I have done over the past 10 plus years online is I've built my group on Facebook, Weight Loss Resources with Dr. Miranda. It just empowers women on how to advocate for themselves,
Right.
because a lot of the things that, it's like most women are never told about pelvic health unless they luck into some little obscure practitioner that says you need to go and get X, Y, and Z done. Yet when you think that 50% of women over 50 are having issues with it, that's a huge percentage, and nobody's being told.
Right.
Very often if women are having menopausal or perimenopausal symptoms, or let's say they leak a little when they cough, or they're having, some constipation or some sexual dysfunction or any of these types of things, they go to their doctor and they bring up those concerns and they're told, it's just on your head. Here, have an antidepressant. And that is the norm. Women's health care really sucks.
Yes.
And so, it's like if you are not out there learning about this stuff and advocating for yourself, there is no doctor out there that has more of a vested interest in your health than you do. So that's why it's important to have these kind of conversations like what we're having today, because we have to empower ourselves with this information so we know the questions to ask, the treatments to demand, what to look for, and how to advocate for ourselves. Because if nobody ever teaches you how to do that, you just don't know. And then you're operating from that stance of unconscious incompetence where you don't know what you don't know.
Right.
And so it's like any time that we can have people empower women on how to have better health care, I am a huge proponent.
I've
of
also
that.
heard there's a lot of misconceptions about things. It's crazy.
I pulled up stats, and we can get into that
I love
in a
that.
little bit. Jason and I usually come to the table with statistics, but it is absolutely insane how poor quality women get. And a lot of the procedures, some of which cause some of these pelvic floor dysfunctions, it's like if women go in and get a colposcopy where, they have a little bit of their cervix sampled, or they have a LEAP procedure, or they have an IUD inserted, it is very, very common, more common than not, to have all those procedures done. I had a bladder biopsies, and I had uterine wall biopsies done just this year. They go in and they do it with no anesthesia.
Oh,
What? Wait a minute, none?
None.
But if a
None.
man came in with a wiener problem,
Oh,
sorry.
yeah.
Sorry, guys, but I guarantee
you better get that.
you
If
would
I'm
have
going
had
in there, you're doing
And
stuff to
what
me.
they'll tell women is that, it's only going to take 5 to 10 minutes. But you know what? A vasectomy only takes 5 to 10 minutes, but you can guarantee, because someone's getting, their gonads cut, that they're getting, they're getting some anesthesia.
Right.
But women have a lot of procedures done without anesthesia.
Okay, well, why is that, though? That doesn't make sense to me.
There is a gender bias in healthcare. There's a huge gender bias in healthcare.
I mean,
Huge.
so you're saying if even going to a female doctor,
Yeah.
they're not
Even a
using it.
female.
Oh,
even a female doctor. Because who was she trained by? Sorry, I don't.
No, go ahead.
This is going to sound.
No, I mean
This is
that's
like
why we're
my-
here,
That's why
because
we're
I
having this
want
conversation.
I want to
Yeah.
hear this,
But
because
let's just
I don't
be
know.
real here. It's like these residents, these female physicians, most likely they were trained by a male physician. I mean, that's just how
I heard even in the birth world, I heard it's kind of the same thing.
It
It's
is.
like is that doctors will kind of just perpetuate what they're taught, even
Yeah.
though it's not technically probably the best practice for the scenario in the birth. But
Right.
that's just the way they do it.
Women
And-
are given less pain medication than men. When you look at control group studies where they look at a person and they'll say, okay, issue for issue, they pure match these groups. Women get something like 70% less medication, less pain control than men. And,
I mean,
I see
that's-
Jason's face. He's
that's
like
just-
absolutely perplexed.
I
that's
never
right.
thought everybody got the
Yeah.
same thing.
No,
I mean,
no, women get substandard care. It was, and women are diagnosed significantly later than men on average across over 700 different diseases. And some cases, women have to wait up to 10 years for the right diagnosis. So,
for instance, endometriosis for women can take up to 10 years. They see 1 million doctors, and it can take 10 years for them to be diagnosed with endometriosis. And it's such a simple screen.
In over 700, there was a study that came out last year. I think it was they looked at over 700 different conditions, and there was only 2 or 3 that women got diagnosed in a shorter duration of time than men, and one of them was osteoporosis. Almost everything else, so the 700 other diagnoses, everything else, the man was diagnosed in a shorter length of time.
But what's the, is there a cause for that? Or is that
I'm just trying to...
Because women are dismissed. When you go into your doctor, you're told you're emotional, it's in your head,
right.
That it's not really real. Oh, just live with it. I can remember, it's like we all have our crotch Nazi stories.
Crotch Nazi stories. I like that term.
Laura is laughing because she knows.
I know.
That's the name of the episode, Ian.
I could do that.
17 years old, I went to my first gynecologist, and I will say that Canadian physicians leave something to be desired because there is no physician of choice. You go to who you're told to go to, and you wait 9 months in a queue to get to that doctor, and they think they've got the God complex because there is no competition. But I got the pleasure of going to see this middle-aged German gynecologist, and she was a crotch Nazi. She was absolutely my first experience. She used forceps that were too big. They were for somebody who had already given birth, not somebody who hadn't.
17-year-old?
Yeah. Not a 17-year-old. She berated me for being too skinny.
Oh my gosh.
She put me on birth control that was so strong that it made my estrogen drop below that of a 55-year-old woman. So I was 17 going through menopause because of the crotch Nazi. It was just a horrible, horrible experience. So, and I went out of my way to try to find a female back then. And I have ever since. I've tried to find female gynecologists for that reason. I figured that at least you can bond and rapport, that you have the same parts. I don't think a man has the same sympathies.
Empathy towards
I don't know. Some of these guys today...
Well, I have a good urologist now because, I've had some of these issues this past year, and, I've had to have bladder polyps removed. I had over 35 bladder polyps removed.
Oh, gosh.
Not fun.
No.
That was actually, you saw me at the hospital. I was still walking around with my catheter bag when Stoney had his accident. So, and one of the things that was interesting talking to him, because he is a urogynecologist, I believe, he focuses on the urogenital issues in women, was that these bladder issues are much more prevalent in people that have inflammatory bowel disease because they're going to the bathroom and they're pushing all day long, which begot a conversation, between us. I was like, well, what's everybody doing now that they're going to the bathroom and they're sitting playing on their phone for half an hour? They're creating a huge amount of issues.
Problem.
Yeah.
Yes, absolutely.
So, but yeah, to get back, women in general get very, very substandard care. And we have a long way to go to even hit equality.
So, so what's the? How do you fix? So there's going to be more. So in essence, do you need to have more clinical trials with just women to kind of build up a database of knowledge? I don't.
Well, the problem is that on average, again, it takes 8 years for the current research to, get to the physicians. But even when it does get to the, they're going to do what's comfortable.
They're humans. They're going to do what
humans. They're going to do what's comfortable.
Or
the way that healthcare is going now trying to be PC. The way that things are going now in healthcare, women are seen 5 minutes, at their
the
primary
average doctor
care.
has less than 7 minutes to see a patient.
7 minutes, right?
So there's an expression in the field for it. You've got 7 minutes, and often several of those minutes are taken up by your assistant that comes in and does their height and their weight and their blood pressure and everything else. So you can come in and you can hit the ground running. Doctors, they only want to hear about one complaint. Your chief complaint when you come in. You can't really come in with a laundry list, and they're used to kind of steamrolling you to get, to go through the OPPQRST and decide exactly, do their little checklist so you can get out, because they can only bill so much for insurance too. So they can't spend 30 minutes sitting with you going over all your issues, and it's created a real dichotomy within healthcare. One of the studies I found was a Canadian study, and it said that the odds of a surgeon recommending knee replacement for osteoarthritis was 22 times higher in a standardized male patient compared to an identically standardized female patient. 22 times. That is...
Wow.
That is just,
okay.
I don't,
this is stuff I would know. I mean, it's
scary.
But I do have a mother and a sister. So,
you have a mom and a sister.
It's...
And, if we keep plugging you on the show, you get a significant other. But it is pertinent to everybody because, like I said, if you don't advocate for yourself, nobody's going to advocate for you. And so you have to kind of know this stuff going in, that the doctor's going to try to dismiss you, and you're going to have to say, no, this isn't normal. I know my body, and, we need to do advanced testing. We need to, look at what therapies are out there, because women tend to get dismissed, and that is far too common, and it's far too sad.
That's a shame. I'm sorry, dude. That's horrible. I mean, my mother and sister have never complained about their doctors,
but
in the way of kind of like.
She might just not have told you, because 84% of women report that they were treated differently by doctors because of their sex.
Wow. I'm about to ask them that now that it's on my brain. Next time I said, tell me about your last doctor visit. They go to more doctors than I do, so it's a little bit different. But I want to ask you, Lauren, a question here. What are some of the biggest myths surrounding pelvic floor therapy? What's kind of supposedly said out there, but it's kind of maybe not necessarily true or whatever?
Yeah. Well, I guess a lot of people think, pelvic floor physical therapy is all about like Kegels, which is just these set of exercises where you're contracting your pelvic floor muscles. And so anytime there's any incontinence or, I guess doctors, they're just very unaware, but, they just give women this, you're incontinent. Oh, do Kegels. Oh, you're having pain with sex. Oh, do Kegels, And actually,
it feels like a write-off.
It's a write-off. It's a blank, like, you got to do your Kegels. But what...
It's like when they tell women that are struggling with their weight just to eat less.
Right.
Eat less and exercise more.
What a good analogy. Yes.
Because you know what? It's like if it was a matter of eating less and exercising more, everybody would be relatively the ideal weight.
Right.
But, it's just like, it's easy to tell a person, it's your fault.
It's
It's your fault because you're not doing your Kegels. It's your
Right.
fault because, you're eating too much, as opposed to most women that have weight issues have an underlying hormonal imbalance, which probably could be said for most people with pelvic floor dysfunction too, has some level of hormonal component.
Exactly. There's definitely a hormonal thing. But what I was about to say is that I would say like 80% of the patients that I see actually need to not do Kegels. Their pelvic floor, there's a lot of tension there.
So tensing's not going to help.
Tensing more is not going to help with pain with sex, constipation, urinary urgency frequency, endometriosis. Like it's going to actually make things worse.
Wow.
And so that's kind of why I'm on like an anti-Kegel. There's a time and place for Kegels. Like don't get me wrong. But
it's not the one trick fix.
This isn't right. Like I think that a lot of women think like, oh, why do I need pelvic floor physical therapy? I'll just do Kegels at home. I'll just get a device and I can do my Kegels at home. But it's so much more than that. Like your pelvic floor works with so many other muscles in your body. And so you really need like a thorough assessment of everything. 95% of women with low back pain have a pelvic floor dysfunction.
Wow.
So statistic, holy cow, 95%.
It's crazy.
Have a pelvic floor dysfunction. So, so we need to be doing spinal assessments, looking at the pelvis, looking at the hips, looking at the muscles. Are your muscles relaxing? Are they not relaxing? Is it a nerve involvement? But we're just giving this like blanket, like, oh, do your Kegels, that'll solve urinary incontinence and pain. And
it's interesting to hear. I'm between Jason and I don't think we've heard many stories about these horror stories from women in the hospitals, like in the doctor's offices, things like that. But it's interesting to hear that that may not be something that men, I think, see in the doctor's office. But one thing that I have heard and have had like firsthand experience with people with is that it may not happen in the doctor's offices, but like the mental health in men is one of those areas that we get written off a lot in, that I've noticed personally, is the like, it's treated with the same kind of thing of like, it's fine, you just go out for a brisk walk and drink more water or whatever. And it's like, no, I think that there's something psychologically really deeper than that I think gets written off a lot. So but I think that we are getting to a place where that is, I think, talked about more. And I think that is what this episode, I think, is kind of doing in that aspect too, as well as like we're opening up a conversation. Let's make it normal to talk about the fact that like I don't think it's right to just be written off with just a one fix all. I think that there's something else at play here.
A lot of times it's just an effort just to get men to actually go to a doctor.
Like, hey, you're right.
You know, so
you're right.
you know, there's a lot of men. I know several people who never go to a doctor.
Well, over 80% of healthcare appointments are driven by the female head of the household.
Mm-hmm.
So men will usually only ever call up and make a doctor's appointment themselves if it affects their work game, their play game, or their sexual game.
Yep.
And if it doesn't affect one of those three things, men don't go.
Right.
So it's like they'll go home and they'll gripe to their wife and they'll be like, well, I'll just make you an appointment. No, I'll be better next week.
No.
But those are kind of the three categories. When you were talking about the 95%, I thought that was interesting because I am a vitamin person. My specialty is nutrition. And one of the things that we run into very, very often is over 90% of people with low back pain also have chronic vitamin D deficiency.
Yes.
So it would be very interesting to see a study that correlates pelvic floor dysfunction and vitamin D deficiency, because it sounds like the two might go hand in hand.
I was going to ask that.
Correlation is not causation, but that is a big enough coincidence that somebody should be looking into that.
Yeah.
Interesting. I was going to ask the same sort of thing. Is like, is there a few things that cause a pelvic floor issue, or is it just kind of a?
There's a lot.
I can imagine. But
well, let's just talk first. Let's talk about the emotional part.
Okay.
Right.
Okay, that a lot of people don't know about is that your pelvic floor muscles they respond to stress and anxiety. Mm-hmm. So your upper traps, like, a lot of people are like, oh, I got a lot of stress. Yeah. I know I'm stressed because I'm having neck pain, shoulder pain, right? But your pelvic floor muscles are another set of muscles that respond to stress and anxiety. So when women are under stress and anxious, their muscles down there tense up. And, we're going to be stressed, right? That's just a part of life.
That is life.
It's life, right? But when we're in chronic stress every single day, or we've had trauma, unresolved trauma, then these pelvic floor muscles stay tense and tight. And then this can create low back pain, pelvic pain, and all the bowel, bladder, and sexual dysfunction. So from a nervous system standpoint, when your nervous system is really upregulated because of trauma, your emotions, you can have tense, tight pelvic floor muscles.
Right.
Or you could have a physical trauma, like a birth.
Yeah.
Well, a crash. Sure. Mm-hmm. Like, let's just go into that. I've seen women that have had car accidents and had pelvic fractures.
Oh gosh.
Right?
Yeah.
So like pelvic fractures, femur fractures, and that affects your pelvic floor because your pelvic floor muscles attached to your hip. Mm-hmm. So there could be right. So
well,
physical trauma to your pelvis.
Or you think of your pelvis as this like little, this little bowl that nothing moves.
Right.
But it's very dynamic.
Right.
But people don't think it is. People look at the little Halloween skeleton and they think, oh, it's just like it's fixed and it doesn't move. And, but that's not the way it is in real life.
No, it's not. So, So it could be like in childbirth, right? Or just being pregnant. Those muscles are supporting your baby.
Yeah.
So they're getting strained a lot. Another thing that a lot of people don't know is that your diaphragm and your abdominal muscles work with your pelvic floor muscles. Wow. So if you have some type of diaphragm issue, right, your diaphragm isn't functioning well. Or I'd say like 90% of women do this. Hold their belly button towards their spine, like they're sucking in. So so women, I know we do this, Jason. You don't know this,
don't be surprised.
But we, so that we can look thin, especially if we're in a nice dress, we might like suck in a little bit. If we tighten our abdominal muscles, our pelvic floor muscles tend to tighten up. Which, again, if you're just doing that every once in a while, it's fine. But women that are chronically trying to make themselves look thin by holding their belly button towards their spine and sucking in is what we call it.
Right, quote unquote.
Sucking in, then that's going to affect your pelvic floor.
Wow.
Or constantly squeezing your butt muscles, your glutes. Like that'll cause a pelvic floor dysfunction. So any overuse of these, they're your hip muscles. So running can cause pelvic floor dysfunction, especially
I'm getting called out.
Sometimes they're just the victim because like maybe your other muscles in your body, like your glutes aren't recruiting very well. So then your pelvic floor is like, oh, well, I'll help out. And they help out. And they keep helping out and helping out and helping. And so they get overworked.
Interesting.
Yeah. Men tend to have it after prostate surgery.
Yes.
So, women tend to have it, like I said, after childbirth. If you have a hysterectomy, if you're taking something out of that area, you're creating a void.
Right.
So whether you're taking out a prostate, whether you're taking out a uterus, whether, if you're taking something out, you create a void and something has to fall down to fill that void.
That's right.
Now, I have a question for you because I am a huge advocate that insulin resistance in all of its capacities causes a lot of problems in modern society. Well, how do you feel that BMI, and I know BMI is a whole other kettle of, because I think that BMI is a faulty measurement, but it's a polite way to say that people are heavier than what they probably should be. How do you feel that weight, we'll say, is, I know it's a modifiable risk in pelvic floor therapy, but it also aggravates pelvic floor disorders. So how does that fit in with what you're doing?
It can. I mean, it's physics. So, the more body weight you have, then, the more weight and stress and strain is being placed on your muscles, your joints, right? So, I mean, but is there a direct correlation? Like I see a lot of women that or I've worked with women in the past that were, had a higher BMI, but didn't have a pelvic floor dysfunction. So, it's also about, this is a pressure system.
Right.
And if you can manage your pressure really well, you could have a high BMI, and manage that pressure really well. And you could have a functioning pelvic floor, right? It might not become dysfunctional.
Do you find that women that already have that pelvic floor dysfunction, if they lose some weight, does that take some of the pressure off the system so it helps to alleviate or lessen some of their symptoms?
No, because it's the same in pregnancy. Like you would think that, okay, the baby comes out, right? So it was creating all this pressure and then the baby comes out. Right. But now the body's like, oh, whoa, wait, hold on. How do I manage all this pressure, or the lack of pressure here? So not necessarily. It's
I read about that being a point in contention in your profession. So,
well, yeah, the pressure. Yeah.
It doesn't sound like it goes hand in hand.
Yeah, it would seem like it, but that's not like clinically like what I'm seeing,
right,
you know?
Interesting.
So do you tend to rely more on behavioral techniques and PT, or how are you treating people in your clinic?
Right. So again, I'm looking at the whole person. So we start with their stress levels, right? We can do all the stretches, or maybe we're doing all the Kegels, all the exercises. But if your stress is high and you're in chronic stress, again, what happens to pelvic floor? Right. So we can all right, fine, we'll keep doing these exercises, but you're not going to get very far. Mm-hmm. So first I want to know about your stress levels. I work with the nervous system, and I help women down-regulate their nervous system. Their vagal nerve, you probably know a lot about the vagus nerve, so I work a lot with the vagal nerve. And then to help calm down their nervous system, which then can help chill out their pelvic floor. So working with the nervous system, again, looking at the spine. If there's a spinal dysfunction, sometimes, like I mentioned, that can cause pelvic floor dysfunction. I'm looking at their diaphragm. Again, remember, diaphragm, abdominals, pelvic floor, they all work together. So I'm doing an assessment there. Like, are you breathing? I mean, we're all breathing. Right. We're all breathing, but can you take these
shallow
big
breathers out there?
Exactly, yes. Shallow breathing, or can you get big, deep breaths using your diaphragm? You know, what about your abdomen? Can you let go, sister?
Right.
You gotta let go of your abdomen. We can't keep sucking in. How well can you do that?
I feel like
she's trying to look good.
Yeah. And I don't blame her. I get it.
Like, I've been there.
So with safe space, yeah. It's like, I get you, sis. I get you. But this is not helping your pelvic floor.
Right.
And then seeing how your pelvic floor muscles, your diaphragm, and your abdominals are all coordinating, because sometimes there's a discoordination, right? So it's like you can Kegel, but your diaphragm and your abdominals and your pelvic floor aren't functioning. So I'm looking at that. I will do an internal exam. So it's not the same as when you go to the gynecologist and, you know, your butt's hanging off the edge of the table. Miranda knows. The boys are like, what?
I don't know anything about that.
Yeah,
no, y'all do not know anything about that.
But see, you know what? If men had to go through it, they would have invented a better way.
A way better. With the I don't have the stirrups and the speculum, and I don't have any of that. Like, again, I'm just want to feel your muscles. Like, I want to know what's happening. You know, is it painful when I touch these muscles? Can you contract? Can you relax? Like, that's the kind of information that I'm getting. I do have ultrasound technology, so I'm able to see the pelvic floor muscles, and the abdominal muscles contract and relax. So sometimes I'll use that. So, you know, there's a lot of women that have had sexual trauma, physical trauma down there. And I respect and honor that. And I'm not going to do an internal exam on somebody that's had that kind of trauma. And so I can use the ultrasound to take a look at how everything's coordinating, functioning. So yeah, I guess that's ultrasound. Kind of, so that's just kind of like a typical exam. And then of course it's different. Like I told you about my birth prep program. So like, I want to see like how you push.
Right.
Like, how are you pushing, sister? Like, ooh, that's not a good, efficient, effective way.
Right. It's better to figure it out now than whenever you're in the moment.
That's
and you're like,
right.
I can't
do this. An hour into it. Right. Exactly.
Right.
So yeah, talked to a mom this morning. Her physician, she mentioned to her OBGYN, she's like, when she was pregnant, hey, I heard something about pelvic floor therapy. Like, should I get that? And she said, oh that does sound like something that would be great after pregnancy. So she called me and she's like, yeah, I just want to set something up postpartum. And I said, but what about right now? And she goes, well, what would we do right now? And I said,
like,
well, a lot. We're going to prevent you from having to come see me postpartum. How about that? Anyway, she came to see me. She didn't even think she was going to have a natural birth. That wasn't even in her plan. But
you converted her.
I converted her. She had a natural birth. I talked to her today, and she was just like, I can't believe I did it. I can't believe it. The recovery, she's like, I didn't tear. I'm walking around. Like, I feel great. This is amazing.
I've heard a lot of stories like that. That's like, it's kind of it's a miracle what a woman's body can do.
Yeah,
like,
it is. Yeah. It is.
Especially with the proper people in your care that can really make sure that you are taking care of every step of the process. That is one thing I've heard numerous stories. Again, like I said, I know a lot about this stuff secondhand from my fiance, but it's like I've heard a lot about that. It's like if you have people that will prepare you properly for the situation that you're going to be going into, 9 times out of 10 you're going to probably be.
Yeah, well, talk about it like a marathon. Or half marathon, right? Jason does half marathons.
Not a full marathon.
Not a full marathon, but even a half marathon. Okay.
Yeah.
But like, can you do a half marathon without very much training?
No, you can't.
Yeah.
I mean, you could do it. It might take you a really long time. I mean, right? You could walk that.
Well, it depends on
it's going to be painful.
You can
depends on
try.
how
Jason,
well you're
painful.
how well conditioned you are prior to. So if, say, you were a runner and have been training, on a regular basis, and then all of a sudden maybe you got to stop for a couple months. Mm-hmm. If you got to jump in and do that half, you're going to feel it.
Yes.
Mm-hmm. Can you do it?
Yeah.
Yes, you can do it.
Mm-hmm.
But you're gonna
you're gonna regret it.
You're gonna be like, after the first mile or two, like, oh, okay, yeah, I definitely see a difference here.
Right, exactly. So that's kind of how I talk about birth, right? Especially a natural birth, but even medicated births, okay?
Right.
Is that it's kind of like a marathon.
It's a physical activity.
If you get some preparation and some education, and you have like a pacer, even, right?
Yeah.
Because it's so
person
helpful.
with the sign.
Yeah,
exactly.
your support system. You got a good support system. Then things might go a lot smoother, right? Mm-hmm. I can't make any guarantees,
of course,
to patients, right? Just like
a
marathon, you could sprain your ankle. You could train, you could do all the training and like all the preparation and make sure you're super strong and everything's great. But you could sprain your like things could happen.
The thing is also is that everybody has it. If there's one thing I know is that everybody's different. We're all very similar, but we're all different. So even though everything may be okay, sometimes there are conditions that pop up, or some things, there are things that happen that warrant out of your control, that warrant things to be changed. But for the most part, again, surprise, a little bit.
See, Ian, I didn't realize you were. I didn't realize you were kind of more aware of all this stuff.
I mean, not all of it, but like I said, because it is not only is it a career path, but it is a passion of someone that I care very deeply about. Obviously, I talk about my day from work, and she talks about her day from work and things that go on, and and so it's interesting because, again, I'm also a pretty curious person, so she's interested in this, and so I ask all the questions like, well, how does that work, or why do doctors have to do it this way, or whatever, and she's like, well, it's just the way they like it, exactly, or whatever, and so there's been numerous conversations where I feel like we've had a very similar conversation to this. Is like there's a lot of misconceptions about natural birth and that whole world and everything that goes, or because of the fact that it's a quote unquote little taboo to certain doctors and people, but with the right care and the right people and the right team behind you, they can really make sure that they have your well-being as well as the baby's in mind. A lot of magic can happen.
The birth process is, I would say it's something that's in flux in this country right now. I had my kids, I started in the year 2000 and I ended in 2010. And I had 2 natural births where I did it completely au naturel without so much as a Tylenol, and then I had 2 emergency C-sections.
Ooh, yikes!
So I was at both ends of the spectrum as far as the birth experience. And my 2 natural ones were with midwives. And like I said, the other ones were as much intervention as you can have, intervention. And I will say that, it's definitely, you go into the hospital and you kind of get steamrolled.
I've heard.
You really do.
I've heard.
You're just like, you're told, oh, we're putting in a cath. Oh, I don't want a cath. Well, it's our policy. Well, is it really your policy, or are you just being lazy?
Yeah.
Because it's just like, I can manage to give you a clean catch. You don't need to do a cath. There's a lot of things that they'll say that they need to do just because that's the way they've always done them.
Of course.
And so when you go in with a birth plan saying, look at, and just like even with what Lauren was saying, if you're doing some training beforehand so you know what to expect, that's half the battle. Because most women go into the hospital to give birth and they don't know what the heck is going to happen next. And they have nobody advocating for them. I was very, very fortunate. I was in chiropractic school when I had my first two kids. And the girl that sat behind me was a labor and delivery nurse.
Wow.
And she was a spitfire. Susan, if you're listening. But she actually, I called her when I went into labor and she met us at the hospital. And it was not her hospital, but she took over the labor and delivery room. And
I love it.
That's awesome.
And I'm one of those people that have the world's fastest labors. My first one, from my first contraction to when Cole was born was 2 hours. And when I had Katya, that was 90 minutes from first contraction. So you don't have a whole lot of time to transition. So things get kind of abused. But, it's the whole process is just traumatic. And I don't care where you are in the United States, there is very, very few women that have a happy birth experience.
Right.
In some way, in some regard, it is not the high point of your life. You're happy to see your kid, but that whole birth experience is traumatic.
Yes.
It is undignified. You are poked and prodded in all the worst ways. You are told to hurry up. You are told to stop, push. It's just like there's a lot of stuff that is put on you that really shouldn't be. And then you're dealing with doctors that at a shift change that want to go home. Or, it's Friday night and it's 7:00 and they're out of there. So, you end up, I hope my mother doesn't kill me. When she had me, I think the doctor came in off the golf course or, it interrupted his day. He ended up sewing her placenta to her when he was stitching her up.
Come back now. Say that again.
Yes.
Jason's like, slow down.
Slow down a little bit.
I need you to say that one more time.
Yes.
Say that again.
Because it was routine to give women episiotomies up until relatively very recently.
Okay.
And a lot of women still are given episiotomies where
Jason, do you know what that means? Oh, okay.
Yes.
You're about to explain.
Yeah, you got to back
like,
up. Okay. Go back to what your mother, kind of retell the story. 'Cause I missed part of this.
You did not miss anything.
Yeah.
He was in a hurry. And so instead of waiting for the placenta to be delivered, he stitched it to her.
He stitched it.
When he was stitching her up, he stitched that placenta into place. Yes.
Yikes.
So she had to get unstitched and have the placenta
because
delivered.
that's a natural part that's supposed to...
Right, that normally comes out.
It's supposed to come out. Yes.
Right.
So having it linger in there still like it's not a pleasant experience.
No. But you know what? You talk to any woman, they all have a birth horror story.
Yes.
They all, if it wasn't them, it was someone in their immediate circle.
Right.
And so, that's a lot I mean, when we were talking about these 50% numbers of women with pelvic floor issues.
So how many women, I mean, this whole pelvic floor arena, how aware, how many people, is it something that's kind of like out there where people are aware of it? Is it something that's circulated, or is it just...
It is now. I'd say
it's like
it's
Ebola.
really grown.
You know about it, but you don't know about it.
Right. Well, I think, and I can't remember, but I was just at a pelvic health conference and they were talking about this, like how well known in the social media that's really highlighted pelvic floor dysfunction. I mean, that's the one blessing of social media. They were, I think they did, it was like a survey on women, before social media, how well did you know about pelvic floor dysfunction versus now? Anyway, but it was up by 300% or something like that. I don't know. It was crazy. I think
there's still confusion around it because women will think, okay, well, I leak when I sneeze, or
normal.
I cough. That's normal. Or okay, well, maybe I have a little bit of damage because I'm leaking when I sneeze. But they don't realize that their chronic constipation is also pelvic floor dysfunction.
Yes.
They just think,
right.
I'm constipated. It's normal for me to have a bowel movement once every 7 days.
Right.
And like, how many times do you run into that?
No,
like you laugh.
I
you
laugh.
We run into that on the daily.
I'm
daily.
laughing at it just out of sheer
and they'll go to their
surprise.
doctor, and their doctor will just say, "Oh, well, you need to take some magnesium citrate," and they're never told.
Is that the stuff they give you when
else.
you do your colonoscopy?
It can be. It can be.
It's kind of that on
yeah.
steroids,
You're
you know. But yeah, no, you're absolutely right. And even when I talk to moms and they're coming in for a bladder issue, and then I said, "Well, let's talk poop." Nobody wants to talk
While we're
shit.
here.
Nobody wants to talk poop. But yeah, but they're like, "Oh, I'm fine. I go every day. I'm regular." And I'm like, but what does it look like?
Yeah.
I mean, I know, you know,
Right.
but is it like little rabbit? Little rabbit? And like, oh yeah, but that's normal for me. I'm like, yes, it's normal for you.
Yeah, but that's not.
But it's not normal, and
Right.
you're constipated.
Yeah.
You know, and then I'm also able to see that on my ultrasound. Like,
Yeah.
sis.
Yeah.
What most people don't realize when it comes to poop, and I have plenty of poop conversations.
I love talking poop.
is that if you are a person consuming a normal caloric intake of a diet, you should have approximately 1 inch by 16 inches of stool a day.
Wow.
So
Your forearm.
yeah. So it's like if you're not having, if you're having a 1 inch round stool and it's not, you're not having 16 inches of it over the course of the day, whether that's 2 8-inch stools or an 8-inch stool and 2 5-inch stools,
Right.
however you want to break it down. If you're not having at least 16 inches of stool a day, you're constipated. And a lot of people think, oh, well, I go once a day, but if you go once a day and you're having a little 3-incher,
Three
the
little bitty
the
nuggets. Yeah, the volume.
has a lot
So everybody
to do with
look
that.
at your forearm right now. That's how long.
I've been told before is that it's not about quantity; it's all
That's
about
right.
quality.
Quality. Exactly.
I was like, okay. When it comes to this discussion specifically,
Well,
I was like, okay, makes sense.
Well, we're talking about this awareness. I found this study, and how much do women really know about pelvic floor physical therapy? And I don't know if you've seen any of this stuff, but this was presented at a conference last year. They say 68% of Caucasian women, 50% of Black women, and 47% of Hispanic women were familiar with the term pelvic floor. However, 35% of white women, 19% of Black women, and 33% of Hispanic women were familiar with pelvic floor physical therapy team at the hospital. So I don't know if there seems to be I don't know what the deal is with that. And an overwhelming majority of white women knew about Kegel exercises, 91% compared to 76% Black women and 73% Hispanic women. However, only 26% of white women were familiar with pelvic exercises other than Kegel. Is that as compared to 40% to Hispanic women and 20% to Black? Have you found that kind of, in your practice?
Interesting.
These kind of breakdowns?
Yeah, I would say
I feel
so.
like Kegel is like even I know about what that is. Like
Right.
it feels like it's a popular term, or it's been talked about before.
Right.
But even in my own, if you use me as a use case, I don't think I know any other pelvic floor exercises personally. So that's
everyone's getting yoni eggs for Christmas.
You get a yoni egg.
Oh yeah, I think I'll pass.
Yeah.
Well, it just says basically at the conclusion, that knowledge of pelvic floor physical therapy remains relatively low, regardless of race and education levels. So
I think that part
must
of that,
not be out there as much as it should be.
I think part of that has to deal with socioeconomic status and insurance levels. Because the better your insurance, the more apt you are likely to be told about pelvic floor therapy.
Right.
If you have, let's say you're on Medicare, or you have, an inferior insurance product, you are because you have to be turned and burned out of that office so much quicker.
Right.
You are less likely to have someone take the time or make the referral that you need to get pelvic floor therapy.
Right. I agree. 100% with that.
Wow.
Crazy.
Interesting.
Yeah.
I mean, you bring these topics up. I had no idea what any of this stuff was. I mean,
I've
I
got
learned
about
a lot.
7 pages on all these things about women's health care.
Yeah, it just brings me so much joy because I love how you have all these statistics and how you're super passionate about women's health too. Because
a lot of the people that found me because of gallbladder issues, and it was one of those things that I had done an appearance on a radio show, actually when I was pregnant with my youngest child. And it kind of, I kept my transcript from that radio show. It was on the bariatric radio station that someone had interviewed me for that. And, and I spoke about gallbladder issues because I have inflammatory bowel disease, and I've always talked about inflammatory bowel disease and, a lot of just bowel health issues. That is one of my passions. And one day on my blog, I put up my transcript about my gallbladder stuff, and it took off, and it went viral. And, I was getting over 700 hits a day just on my gallbladder post for years. Years. It was crazy. And that drove most of the people that follow me on Facebook found me because of gallbladder stuff. And that kind of got me down the path on, when you look at, 75% of the people that have gallbladder surgery are women, but they take on average something like 20 minutes longer to do a man's gallbladder surgery than a woman's. Why is that? Are they doing a substandard job on the women? It's just you start getting questions.
Yeah.
I has questions. And then that got me down on this whole, down the rabbit hole on all of these issues about women's health and how women get substandard care on so many, women can have DNCs with no pain med. It's insane when you start doing the deep dive on women's health care. It's just women have hysterectomies, which is major surgery, and they're only given 72 hours of pain control. A man can walk into his family doctor and say, you know what, I pulled my back this weekend, and they'll be given a week's worth of medication, and no one will bat an eye. But a woman will have major surgery and be given 72 hours of meds. Mm-hmm. And nobody tells her that, she's going to have issues with her bladder and her bowel and all this kind of stuff after. I know in my group, very few women were ever told that their hysterectomy would lead to pelvic floor dysfunction. Right. And most people have it from having a hysterectomy.
Right. And there's lots of women getting hysterectomies because of pelvic pain and are still having pelvic pain after hysterectomy. And now, also have bladder prolapse and other issues. But this was never something that the physician.
What can you do for bladder and bowel prolapse? Because that is a increasingly common issue for people.
It is. So, going back to poop, it all comes back to a bunch of shit.
There you go.
Can I
That's
say
a
that?
way of putting it.
But seriously, I think a lot of women, so statistics, 50% of women that have a prolapse surgery fail. The prolapse surgery. 50.
That's a huge percentage.
That's a huge percentage, okay? And it's but why? Why is this happening? Well, because why were they getting prolapse in the first place, right? And we know that it's a pressure issue, right? So this is a pressure system. I have 2 valves, one here and one down here. If I'm constantly closing my mouth and I'm bearing down, where's the pressure gonna go? Right? It's not gonna escape this valve. It's only got one valve down below. And so women are having poo-poo babies every single day, right? We think, of prolapse being, because I pushed a baby out. Yeah, but it could, that is one.
Well, now
common cause if you're
half-hour bowel movements,
but if you're having
TV time
right time on the toilet, looking at things and bearing down and pushing, that can.
So, do you like squatty potties?
Love a squatty potty. Definitely love a squatty potty. Promotes squatty potties all the time. We should
what other equipment can people get at home that can maybe facilitate better?
Flip a trash can over.
Okay.
You know, like
okay.
if you're traveling, you know, put your luggage underneath your feet. You know, if you're somewhere that right, because a lot of people are like, oh, but when I travel, I can't just travel with a squatty potty. You have luggage. Put that underneath your feet, because that opens up your rectum and relax the pelvic floor. And it's actually how we're supposed to poop, where our knees are higher than our hips. It's how they like do it in China.
Right.
I'm very glad that having inflammatory bowel disease, I'm very glad that we don't have those kind of toilets here.
Right.
It would be very messy.
Very messy, very yucky. Yeah.
I wonder how that evolved.
Well,
a hole in the ground. People pooped over a hole in the ground.
Back in the old days,
but then
it was
who invented the
down
toilet?
house.
Yeah, and they jacked it up.
The Romans had toilets, you know,
Right.
but it was
Right.
it was like it was a group activity, and everybody was in a row, and they shared a sponge on a stick to wipe with. So all I must say is they must have had a lot more fiber in their diet if they were all just sharing one sponge.
Right.
That's hilarious.
Well, let's all get together and go hang out and go take a crap.
But that's how it was done.
Yeah. Yeah.
No shame.
No shame. No. So love a squatty potty. And like I said,
is there other
get
things
resourceful.
that you tell people to do at home?
To have a better bowel movement?
No, just in general to help protect their pelvic floor.
Well, yes. So you can, like, I definitely tell women that have just had a baby, but like using toilet paper and splinting your pelvic floor while you're having a bowel movement or peeing. To protect your pelvic floor, just like holding that sling of muscles can be super helpful. Blowing out. So I tell them to blow like they're blowing kids' bubbles.
Okay.
Right? So you have to like purse your lips and go, so that's better than, you can't see me, people in their car can't hear me, see me, but like bearing down and turning red. You know,
you almost want to give everybody a kazoo to blow while they're on the toilet, because then they could be entertaining themselves with musical accompaniment to going, and then it would be so annoying that they would try to get it done quickly and not hang out there for too long.
Right? Yeah. So don't bring your phone in the bathroom. Blow bubbles. Put your feet up on a stool. It
if it's been more than 5 minutes, get up,
exactly,
and leave, and then come back again when the pressure tells you to.
Exactly.
Well, I won't try this next time I go to the bathroom.
Yeah, do not stay there longer than 5 minutes. And honor the urge.
Yes.
Period.
Wow.
Honor the urge is what I tell my moms, that, you know, as women, we put ourselves last, and we're taking care of kids, and we're trying to get out of the door, and blah, 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 blah. And we might have had a feeling, and we'll tell ourselves, I'll go later. I'll go later.
No, you got to go now.
You get your butt to the toilet. Get your butt to the toilet.
And
make the
people
bowel
without a
movement.
gallbladder already know that issue.
Oh, yeah. They got, right.
When you have that urge, you got to listen. Because if you don't, it's going to get bad.
Right. But people that are constipated, actually, if they're chronically constipated, that urge, that signal starts to diminish. It becomes like a whisper.
And also if they're dehydrated.
Exactly. And so it becomes like a whisper, and so they don't feel it like they should. And so
I think a lot of people kind of walk around and they don't listen to a lot of the cues that their body gives them in the first place.
Absolutely. We're so disassociated with our bodies.
I've had friends,
disassociated.
I did a lot of talks with some friends that were like really big into like sleep research stuff, and a big thing they were talking about was it's a surprise. Like it's very surprising how like there is a moment for a lot of people where they get really tired, they get sleepy, and then you just push past it, and then that feeling will go away. Same thing kind of with hunger. Your body kind of will go through these motions where it's like it hits this peak and then it disappears.
That's right.
And then the same, and like, but in the discussion we're having with sleep, they were like, there's a lot of times where like if you feel like you're winding down, you feel like you've gotten yourself ready. If you feel that urge, like you're feeling tired, like you're gonna go to sleep, just go ahead and go to sleep. Because that's like the best time to really just hit it, and then or with your hunger or whatever else it may be. But you're right. Is it people? I don't think that.
not listening,
aren't listening what their body's telling them, which is, I think, really important.
Or they're listening and then they're like, I'm ignoring that because
exactly.
I want to watch the rest of, I don't know,
right,
Bridgerton or whatever.
The thing is, I'm a person that likes to, with sleep specifically in the past, I've been really bad at that. I'll work through being tired, and I know it's a bad quality, and I can attest to it. But as a person that the work I was doing as being like a freelance artist and stuff like that was the thing. It was like I can just keep on going. I can keep on going until like I was not getting quality sleep. I was like, I'm in a bad spot. But I'm a lot better now. A lot, mostly because I know that I am me, but also my body is a physical body that has limitations, and I need to listen to that.
Yeah.
So, but anyways,
tell me, what are you most proud of as a pelvic floor physical therapist?
So I guess just what am I the most proud of?
That's a big question.
It is a really big question. I just like every time a woman avoids an unnecessary surgery because they got pelvic physical therapy instead. Women that had a better birth, like those kind of things light me up. Like when they call me like,
right.
oh my God, my birth was amazing. It was so different. So, or thank you so much. I was going to get this surgery and I was going to be out for 6 weeks and, out of work for 6 weeks. And I'm just so, so grateful to understand my body. And
right.
I just love educating and empowering women, period, on their bodies and what they're capable of and how much like we can heal,
Oh, yeah.
how awesome and amazing the body is, given the right environments, environment. And just like, I don't know. I love my job. I love helping women avoid, like I just said, avoid surgeries, have better births. Be able to be intimate with their husband. That's another thing. I'm just like, love is women that come in and they're not able to be intimate with their husbands because it hurts. Something that's supposed to be pleasurable, something that's supposed to connect you and your husband and draw you closer, draws you further apart.
Yeah.
And when you can get close again and have that kind of intimacy, it's great. And so when women come in, they're kind of like, I was able to, have sex with my husband and wasn't painful. And now we can get pregnant. Now we can do this because I can have intercourse with my husband. It doesn't hurt. And now we can possibly get pregnant. And that is like, I just get so happy and so excited. And so,
I can imagine that probably is a very big emotional, I can see how that can be a very emotional thing for a person or people in a relationship. And then to be a part of that, it's got to be really special.
Yeah. I mean, solving poop problems is, it's fun.
I can see,
but, when people get out of pain and they're able to connect,
right.
Better with their husband or connect better with themselves.
Of course.
That lights me up. Yeah.
Right. I don't think you probably have anybody who was moved emotionally by being able to poo.
Hey, you cannot underestimate a good bowel movement.
Yeah. Well, you haven't had. You probably haven't been constipated.
You're right. I'm sorry. I didn't mean to speak out of turn. But again, I've heard a lot of similar stories with midwives that I've been able to talk to or been able to be around and have that same sort of experience of. There's a lot of misconceptions. There's a lot of, I feel like personally, in just the conversations that I've been a part of with Mallory and myself and family members and friends and all that kind of stuff, they're just like, oh, that's just the way it is. Right. You got to have an epidural. You got to do this. That's just the way it is. And and to be a part of a conversation of like, well, that have to is a strong word. If you feel the need, you can, but there are alternatives that are potentially better on your body,
right.
and be able to be a part of that conversation. And also me, I've never really known about any of that or been a big part of it or been a part of the discussion. But to be with somebody that is a big advocate and works with a bunch of people that I think are doing a really good work, it's encouraging for me as well to be like, okay, I mean, I can get behind the mission that they're doing as far as like natural birth work and, you know, educating women and making sure that they're okay as well as the children, and all that kind of stuff is just super cool. And so,
is natural birth simply just without
Medication.
painkillers and stuff like that?
In this instance specifically, it is usually there is a nurse present as well as a midwife that is, you know, kind of intervening and all that kind of stuff. But there's no like doctor involved. There's no medication, and it's all done naturally.
Okay,
but they are within very close proximity of a hospital in case there is
a complication.
You know, exactly.
Yeah. So basically, what women were doing for
hundreds
ever.
That's the big
before OBGYNs came in and they were like, oh,
not to say that.
See, women weren't naturally ever designed to give birth laying down on a bed in stirrups.
You're right.
You know, that was, our bodies aren't really designed that way.
Why we have more tears, prolonged labor, all these issues.
And that's a big part of the conversation that I've been a part of with her present a lot of times is like, because there's no heavy medication involved, because there's nothing like that. Your body has a natural way of recuperating, where within a handful of hours you can be up and out of the office. And of course, every time they're like, "Oh my gosh, I can't believe that I had to be there for like 24 hours or whatever," and she's like, "That's just not the case."
Well,
again,
in the 70s and the 80s, when women gave birth, they did keep them at the hospital for 3 to 5 days.
Right.
Now, even if you have a complicated birth, they're trying to kick you out within 24 hours.
Right.
You know, as soon as that 24-hour time period passes, they like do the hearing test on the baby, and you know, they do another vitamin K shot, and you're on your way.
Right.
So,
but in the aspect that I'm talking about is like there have been the stories that I've heard and been a part of is there have been ladies that go in there, and of course within a matter of 4 or 5 hours, they're getting in the car going home. They'll come back the next morning.
Birth center stuff. Yeah.
Are we starting to see more people wanting to go the natural birth?
I am. I mean, I am in pelvic health. I feel like over the last 8 years, I've seen more and more women desiring a natural birth, like having more control over their body, understanding that it could lead to a more optimal postpartum as far as like recovering.
And there's a financial component too, because if people don't have great maternity coverage, a birth center birth is a fraction of what a hospital birth is.
Yes.
So
I think there's a lot. I think there's a lot of factors. At least from what I've heard, I keep wanting to preface this because obviously I'm not a part of this world, not a part of that whole atmosphere. But from what I've heard, a lot of it is like with many things in the world is awareness. Is that people are talking about it more now. There's a lot of good outcomes, especially in a world where I feel like you were saying, everyone's got a horror story with the hospital. To finally hear some stories, at least from what I've heard, of people going like, it was actually not an awful experience, and I was able to recuperate pretty well, and I had a team of people that were really caring about me. It's like a lot of those things, at least in this area, I think are deciding factors, because even I'm not even a woman, and to be able to hear all these great things and have great people that really are fighting for you and are also educating you.
It is very regional because
it's
like I had Kolya and Katya at UTMB Galveston. And UTMB Galveston at the time, this was before the big hurricane, they had a midwife wing attached to labor and delivery. So when you went to labor and delivery, you chose to go the midwife route or you chose to have the medical route. They were all on the same floor. One was down one hallway and one was down the other. So you had your choice, and you kind of knew beforehand because of the type of care that you got throughout your pregnancy which route you were going to go. But you could rest assured that if you had a complication, they just had to wheel you down the hall and you're right there. Versus sometimes with birth centers, they might be 10 minutes away from a hospital. So if you have a complication at a birth center, you still have to get transported.
Now, I'm just curious, since we're a generational podcast, it'd be very interesting to see the views of natural birth from like the boomer generation to the X, which is what we are, to the millennial.
There has been numerous heated debate over a Thanksgiving dinner about this very subject in my family, where grandma may feel one way, where my aunt feels a very strong way in the opposite, and then of course you have me and Mallory sitting here being like, it's not as bad as you think it is, and she comes with all these I think are not super or very specific use cases of where natural birth may not have been the best option for a person and didn't have the proper care, and takes that and then runs with it, which is, I mean, it's most people when they want to justify their belief, and that's fine. But then so anyways,
the grandma would be the boomer,
right?
And then your
even
aunt would
probably
be
even before then,
probably would be kind of the X era, and then they're kind of more hospital oriented. And now I'm curious now with the millennial and Gen Z. Is there now a shift going back?
I think
to get away from that.
I think natural.
I
think natural lifestyle has just being more natural, being more environmentally friendly, quote unquote, and being more green, all that kind of stuff. It feels very much like a movement that was like part of like millennial generation, and even more so, I think. Even so, I'm not surprised that.
I think we're
now
slowly shifting.
Now you have people freeze drying their placenta and eating it and stuff. And
it's
even the hippies back in the 70s
even
were
that feels
doing
like
that.
A special use case. You're right.
No judgment.
Exactly. And that's the same thing. Is that like my aunt has had questions before where she's like, well, do they do that? And of course, Mallory's like, I mean, we could allow it, but no, they don't.
What
really
about?
do that.
I also saw some information regarding natural birth where sometimes they're actually doing it in a tub of water.
That's exactly what happens.
Is that what is that part of the normal process?
It depends on
or is
the
that just kind of an option versus just someone laying on a bed or something?
It's an option.
It's an option.
Yeah, it can help reduce like low back pain. During pregnancy. I mean, there's a bunch of different reasons why women choose to give birth in water. But it's not necessarily tied to like a natural birth,
Right.
You can birth how
you can do whatever you want.
Do whatever you want,
Right.
I mean, I had William in the shower on accident, not on purpose.
Nice.
Kind of happened really quickly. Not in my home, in a hospital.
Okay. I was confused. I was like, oh, that must have been a scary experience.
No, it was in a hospital.
Yeah, I would think that would be pussy.
Yeah.
No, but one of my moms caught her birth on the Nest camera.
Oh gosh! Wow.
She called me and she was like,
"You want to see?"
So I didn't make it to the hospital.
Cool.
And I said,
All
"Well,
right.
tell me what happened." She goes, "Well, I'll show you because it's on the Nest camera on the front." I was like, "Sister," but it was.
Don't share that to the neighborhood feed.
No,
Right.
definitely.
But it was really awesome. And her husband, of course, called like as soon as she went down on her hands and knees and he couldn't get her up and she's like, "No, I'm doing it here." And he called 911, of course, and they were able to get there. But she did it, and he was able to be there. He got the baby. I mean, it was pretty amazing. I have to say. And I was like, was that traumatic or was that empowering? I'm just curious. And she was like, it was empowering.
Oh, yeah.
It really was. Because I felt like, God, I think I would have been a little nervous. I don't know, but she felt good about it.
For me, there'd be a lot of adrenaline. I'd be like, oh man, I don't know if I'm ready. You would be ready for this. I don't think I'm ready for this.
Yeah. And her husband's like, my wife is freaking superwoman, man. Like,
That's
she's
cool.
fucking awesome. Oh, sorry.
Yeah.
She's so awesome. And I was like, I saw her. She is. She's awesome.
So it's like the old days where the man was somewhere else smoking like 5 cigarettes in his hand.
I had some really close friends of mine that just recently gave birth, like the natural birth route, and he was able to be there like for her through the whole process, and I got to see like some pictures of just like the whole experience or whatever, and it was super cool.
I've never witnessed a birth. Well, take that back. I actually have.
I meant more so like it was obviously like the more candid shots of like the baby and stuff, but like but to be able to see that like he was there through the whole process, holding her hand and everything, and like she was also like, I mean, she's a strong woman as well, so it's really cool to see, and it was like it's cool for me again as a person that I think my opinion on it has changed in the past couple of years. Like it's cool to think like I'm also kind of a part of like encouraging people to do that kind of stuff as well. And to see a friend go through that and have people that were there with her, I was like, oh, that's super cool. So, but I think that's, unless you have anything else you want to add, I think that's kind of our time for today. So Lauren,
a very interesting discussion.
Wow. I mean, we talked about pee and poo and sex and babies.
Children. Hey.
Is there something we didn't cover today?
Well, a lot of people listen to this show on their commute. And our aim is to educate and to entertain. And I think we have done that today.
We accomplished that with this episode.
I think so, too. Thank you so much for coming out.
You're welcome. It's my pleasure.
Oh, and by the way, just that episode with her mother was episode 72.
72.
Yes. Oh, and can I add this? Can I plug me?
Sure.
For a
Yes.
second?
Go ahead.
Yes. So my handle on Instagram is the Pelvic Peacemaker. So if you want more information on pelvic floor dysfunction, I'm silly. I do some silly reels, but I try to make it fun and entertaining for women because, like I said, it's taboo. Sometimes women are shameful, and I'm just trying to make it fun and let them know that there's somebody that's out there that cares, and we can make it fun.
That's awesome. I'm glad to hear that. Well, and also for us, if you're looking to reach out to us, we have a Facebook page /Retrospect Pod where you can give us any more suggestions or little short comments. But we also have an email that you can give us the more lengthy comments you have for us, and that's getoffendedtogether@gmail.com. But anyways, until next week, thank you so much for listening. Bye-bye.
Goodbye, everyone. God bless.
Peace.
That's what Stoney normally says. All right. Well, since you took peace on me, I was going to say it for Stoney. I am going to tell everybody to thank your mother because you're the reason why she pees when she sneezes. Good night, everybody.
Good night.